It's time for another mini-sode from a Doctor's Perspective podcast brought to you by your host, Dr. Justin Trost-Claire. Out here in Louisiana, hey, something real interesting happened. I was talking to a lady who recommended me talk to another chiropractor, and turns out this was an activator doctor who passed away. And I told her, that was my thing for like 5 or 6 years in Colorado. And then I just didn't keep my official certification with this company because the seminars got kind of old, stale, and the marketing that they were doing by putting you on the map wasn't really bringing me anybody in. So I was like, well, I'm going to branch out and do other things, and got the other instrument-based certification, and that one never expires. So she was excited and has been referring patients to me just for the instrument-based adjusting. And I said, well, that wasn't initially the angle that I was trying to do, but turns out there's nobody else in the area that does it. Anybody in my city, Lafayette, would have to drive to Baton Rouge, which is about, 2.5 hours round trip. And that's a lot, obviously. And so I say that because I've been kind of marketing with that more for those patients who are scared of chiropractic, who don't want to get their neck cracked. It's just another avenue that there's been people here that like it, want it, and just didn't have anywhere else to go. So it's like, okay, well, there's somebody else here. And for some reason, Louisiana doesn't let you do online CE. And now, like, say, for instance, Activator, it's only online now. And so I guess there's been enough doctors who are like, well, if I'm not going to get credit for it, it's not even worth my time to stay certified. So really, as a doctor, if you're looking to send someone to Louisiana, you're like, I don't know where to send you. There's nobody here. And so good luck. You got to go to like goimpulse.com or something to find anybody that does something with an instrument, not just has one in a drawer, but actually uses it. You know what I mean? So anyway, just an interesting niche that you can find, just like Webster technique and pregnant people, for instance. How do you stand out? And do you enjoy it? So that's not really what the episode's about. So let's jump into this one. This is about ergonomics, some of the standards that you're looking for. If you were to be invited into some company, you can have this on a piece of paper and you can go through and measure all these different distances to see if people are set up correctly, especially those who know they have neck pain or back pain or their shoulder hurts from being on a mouse all day. And we're talking about people that are at a computer more than 6 hours. Less than 6 hours, apparently, you'll probably be all right. Over 6 hours a day, there's going to be a problem. And now you could probably go to like these big corporations. You might be able to get yourself into some big corporations because they get, I guess, discounts on their insurance if they have certain programs that are run. But you might even be able to go into smaller places that have 5 or 6 people and just say, hey, I'd be willing to evaluate your company just for free, just so you know what's going on and get my name out there and maybe prevent anybody from having any problems. Again, sometimes it's nice to have a marketing person do this for you, set this up, and then you just show up. So remember, you don't have to do all this stuff yourself. All right, so anyway, here we go. From your chair to your monitor screen should be 20 inches. From the chair to the monitor screen, 20 inches. The front of your knee to the table, just 2 or 3 inches. The height of the computer to the table should be about 10 centimeters. Your keyboard to your mouse, 15 centimeters. The table to your chair, 23 inches. So again, your working posture, how long do you sit versus stand, your screen to your keyboard, distance to the chair, height of the computer. These are important so that you can help minimize the chance of getting low back pain. Again, chair to monitor screen is 20 inches. Front of knee to the table is 2 to 3 inches. The height of the computer to the table is 10 centimeters. And your keyboard and mouse should be 15 centimeters. Your outstretched arm type of thing, your eyes to the screen is going to be between 50 to 70 centimeters. Over 70 and under 50 are both bad. Okay, that's it. Rewind this a few times. If you want more details, you can do the Evidence-Based Chiropractor episode 338. That's where I pulled this from. It's real quick, real easy. But just wanted to reference that one. That way you definitely can get the full scope of why that's important and just get your brain kind of thinking about these things. You can visit adoctorsperspective.net/M78 for the show notes. I look forward to starting the Local Business Spotlight, the A episodes on the Doctor's Perspective coming up real soon. Listen, think, and implement.